Look at this. This is a morphological drawing of the Variola virus, one of the deadliest viruses that has ever plagued the human species. Becoming infected means that you have a 1 in 3 chance of dying. If you are lucky and end up surviving the infection, you obtain deep pitted scars on your face and body. This virus was for a long time the worst enemy of humans. What is surprising in this fight between humans and virus is that someone figured out, over 500 years ago, a way to combat the Variola virus with the use of primitive technology. How is this possible? The first evidence we have of a death by the Variola virus has a surprising origin from over 3,000 years ago in Egypt. The ancient pharaohs of Egypt would become mummified after their death. For thousands of years, these mummies would be buried in the Valley of Kings, located in Thebes, Egypt. The pharaoh, Ramesses V, was mummified and buried around 3,100 years ago after he died a young and sudden death. In the early 1900s, the mummy was retrieved from the Valley of Kings. His face and body was covered with a rash similar to the rash that developed from Variola virus infection. This led to the hypothesized cause of death being the Variola virus. This was tested by removing a piece of skin and observing it by electron microscopy. An electron microscope is a type of microscope that is able to observe the structure of tiny samples with amazing detail. It works by shooting a beam of electrons onto a sample. The sample blocks the path of some electrons and gives an electron shadow behind the sample. The electrons hitting a sensor can be measured and used to generate a high-detail image. In this study of the skin of Ramesses V, the researchers found the body of a virus. I'm not sure what exactly this means, if they found a random virus, or if they found a virus that matched morphologically with the Variola virus. In addition, the researchers used a different test known as immunoprecipitation to find antibodies that were specific to the Variola virus, indicating that Ramesses V had been infected by the Variola virus. The people that survived Variola virus infection ended up with a surprising side effect. They were immune from infection for life. What this means is that these people with pitted scars on their face would often end up treating the people infected with the Variola virus, since they could not get infected themselves. Given this lifelong immunity, one very interesting question one may ask: is it possible to grant this immunity without the high risk of death? A way to achieve this was figured out in China over 500 years ago. To understand how this is possible, we first need to understand how an average infection usually looks like. Infection by the Variola virus causes the well-known disease called smallpox. The 2 first weeks are without any symptoms. The virus tricks the human immune system into transporting the virus particle into the lymphatic system, and within the lymphatic system, the virus particle is in stealth mode, where it replicates and generates a large army without triggering the human immune system. When this army of virus particles has reached a certain size, then the virus particles produce a signal molecule that makes them attack the rest of the body. This is when the pre-eruptive stage begins, with a high fever of above 40 degrees Celsius or 104 Fahrenheit, together with general discomfort, physical weakness, severe headache, and backache. These initial symptoms are followed by a much worse 2-week eruptive stage. First, there is a rash that spreads from the mouth to the face, to the arms, to the torso, and lastly to the legs. The rash becomes worse and worse. Small bumps form under the skin, called papules. These papules become filled with liquid, similar to a blister, that is called a vesicle. These vesicles then become filled with a yellowish pus, similar to a pimple, and are now called a pustule. 2 weeks after the first appearance of the rash, scab lesions begin to form. As these lesions heal, the the scab falls off and leaves pitted scarring. What some smart person figured out in China over 500 years ago is that if you collect these scabs, grind them into a powder, and blow it into the nose of a patient, then this patient would develop immunity without getting smallpox. In addition, by not getting smallpox, the patient would not get pitted scarring on their face and body. This method of immunity has been called variolation at later times. It is a sort of early form of vaccination, which was not perfect by any means. Around 1 to 2% of the people variolated ended up dying, which is a lot better than the mortality rate of smallpox. However, getting smallpox was not a guarantee, and getting variolated, you were guaranteed a 1 to 2% chance of death. Another big downside of variolation is that some people ended up becoming infectious for smallpox, infecting their family and friends, and giving them a high chance of death. But why exactly does variolation work at giving lifelong immunity against smallpox? Smallpox has a 2-week incubation period with no symptoms, whereas variolation gives immediate symptoms. This means that from variolation, the variola virus does not have this 2-week period where it is able to replicate and generate a large army. The immune system starts combating the virus straight away, giving the immune system the upper hand. In addition, it is thought that drying up the scabs damaged a large portion of the virus particles, making them unable to infect human cells. However, these surface molecules are still present, and the immune system can recognize the damaged virus particles and build immunity against it. In India, a different type of variolation emerged. Instead of blowing the dry scabs into the nose of the patients, they would collect matter from a smallpox pustule and then put it into a ball of cotton. Water would then be added to the ball of cotton, and the skin on the arm of a patient would be pierced with a needle, and the ball of cotton would be added against the pierced skin. This would give a local infection with local pitted scarring, and that's it. The symptoms were not severe as smallpox, and it would grant lifelong immunity. Variolation slowly spread from Asia and throughout the world. What was surprising was that some people did not need variolation to become immune from smallpox. They were already immune without ever having been infected with smallpox. This immunity did not originate from genetics, so it did not spread from parents to offspring. Instead, this immunity was associated with a type of work, milkmaids. How is this possible? This is the Variola virus close cousin called the cowpox virus. Similar to the Variola virus, it causes pustules, but on cows instead of humans. Cowpox has the ability of spreading from cows to humans, giving a small amount of pustules on the human body and not very severe symptoms. The Variola virus and cowpox have very similar surface molecules. If our immune system grants immunity against one, it also grants immunity against the other. By using the same method as Indian variolation, Edward Jenner took matter from a cowpox pustule that had developed on the hand of a milkmaid and transferred it to the arm of an 8-year-old boy who had never been infected with either cowpox or smallpox. The boy only developed a cowpox pustule, mild fever, and some discomfort. He completely recovered after 10 days. To check if the boy had become immune from smallpox, Edward Jenner took matter from a smallpox pustule and introduced it into the arm of the boy. The boy did not develop any symptoms, indicating that he had become immune to smallpox. The cowpox virus in Latin is called vaccinia, from the word for cow, vacca. Jenner decided to name this new method of immunity for vaccination. Vaccination quickly spread throughout Europe and America, completely eradicating smallpox from some countries. However, eradicating smallpox worldwide was quite the challenge, but thanks to two inventions, the freeze-drying of the vaccine and the bifurcated needle, it became possible to get the vaccine to remote areas of tropical countries where it had been difficult to reach. In 1977, a total of 181 years after the invention of vaccination, the last person on Earth would become naturally infected with the Variola virus, completely eradicating smallpox from the human population, one of the greatest achievements of mankind.